Now we will see next types of diabetes mellitus, that are type 1.5, also known as LADA, not car, latent autoimmune diabetes mellitus present in adults. It is present like a type 2 diabetes mellitus, and it shares etiology with type 1 diabetes mellitus. Means presents like type 2 but share etiology with type 1. Okay, and in this condition we have glutamic acid decarboxylase antibodies, and islet cells antibodies. Okay, and if antibody against the islet cells, then alpha beta cells, gamma cells not form, and then there is insulinopenia due to lack of beta cells. Okay, now we will see the treatment. ट्रीटमेंट क्या होगा, हम सबसे पहले देंगे, वी स्टार्ट विद सल्फोनाइल यूरियास, that are glipizide etc. एंड सेकेंड हम देंगे इंसुलिन, और दैट फॉर्म विद DNA recombinant टेक्नोलॉजी. रूट सबक्यूटेनियस ही होगा, रूट विल बी सबक्यूटेनियस, and like we studied already in previous type how we inject insulin. Okay, and now I will tell you about rapid acting and long acting insulin. Rapid acting insulins are Lispro, Aspart and Glulicin, which are given subcutaneous 15 to 25 minutes before diet, okay, before meal. Lispro, Aspart, which are given 25 minutes before meal. Okay, next term is long acting insulin. Long acting insulin includes glargine, okay, T-glutec, which have these are regular insulins. These acts for 42 hours. Okay, and now we will see the next type of diabetes mellitus, that is the type 2 diabetes mellitus, as this is polygenetic inheritance and means does not follow Mendelian law, and it forms due to insulin resistance by insulin resistance in body by resisting high level of adipokines and low level of adiponectins. What these adipokines and adiponectins are? Adipokine, it promote weight gain by increasing adipose tissue, and adiponectin, these decrease the obesity. It also known as angel to prevent obesity. Okay, now we will see the treatment for type 2 diabetes mellitus, and the treatment is most commonly is diet control. We have to control our diet in this type diabetes, and this is the first line treatment for diabetes control, for this type of diabetes, that is diet control. And carbohydrate intake is strictly limited. And then we uh, recommend this patient with exercise. Do exercise, not daily, 5 days in a week for 25 to 30 minutes, not more. Okay. And why we will recommend exercise? Because exercise increase GLUT4 inside the tissues. In the tissues, GLUT4 for this channel promote entry of glucose inside the muscles and the adipose tissue of body. And next we will give oral hypoglycemic by hypoglycemic drugs, which control our HbA1c level. Best control for HbA1c, that is glycosylated hemoglobin, is to control it at 7% or less than 7%. Okay. And it includes drugs that are biguanides. In biguanides we have metformin, and it decreases HbA1c by 1.5%. Okay. And it is contraindicated in patient with nephropathies, that is chronic kidney diseases. Why? Because metformin is excreted via kidney, so it is contraindicated in chronic kidney disease or nephropathies. And it has some side effects also. Side effects are nausea, vomiting, and lactic acidosis and vitamin B12 deficiency. Okay. And lactic acidosis arises when patient is with chronic kidney diseases. Okay. And we have one more drug in biguanides, that is fenformin, which is not recommended nowadays. Why? Because it directly causes lactic acidosis. Metformin causes lactic acidosis when there is kidney disease patient, but fenformin directly causes lactic acidosis in normal patient only with diabetes mellitus. If this drug is not effective, then we give sulfonylureas, and it decreases HbA1c also by 1.5%. And its side effect are hypoglycemia or hypoglycemic attack. Okay. Next, if this drug also not able to treat or not effective, then we give thiazolidinones. Thiazolidinones. Okay. And these have major side effect like bladder cancer or chronic heart failure with different drugs like pioglitazone. It causes bladder cancer. And rosiglitazone, it has side effect of chronic heart failure. And thiazolidinones, it decreases HbA1c by 1%. Okay. If this drug is also not effective, then we give alpha glucosidase inhibitors. And these includes drug acarbose, voglibos, and these are taken with meals. They act by inhibiting sugar absorption in the GIT tracts, and it decreases HbA1c by 0.5%. Okay, decrease HbA1c by 0.5%. Acarbose and voglibos. and it controls also pp spikes, and it has side effect that is osmotic diarrhea. And next come is, if we can't able to control with this drug, then we will give meglinitate, and this include the drug repaglinide, and it also act like sulfonylureas, but it causes instantly burst of insulin into the circulation. It also improves sensitivity of receptors, improves sensitivities of insulin receptors. Okay, and it also have side effect of hypoglycemia. Then next term is DPP4 inhibitors, which inhibit the degradation of GLP-1, increase the duration of action of GLP-1, and drugs includes linagliptin. It is not given in the case of liver disease or hepatic disease, contraindicated in liver disease as it is metabolized by liver. And next is sitagliptin, which is metabolized by kidney, so it is not given in nephropathies or kidney disease, contraindicated in kidney disease, sitagliptin, as it is metabolized by kidney. Next come is incretins, and which includes liraglutide and exenatide. Next are SGLT2 inhibitors, which promotes urinary loss of sugar resulting in decrease of blood sugar levels. And it has side effect of, as sugar will go through urinary tract, then we have infection in the urinary tract, so urinary tract infection increase. Okay, and drug includes sanagliflozin. And next diabetes is Moti, not prime minister, maturity onset diabetes in young, and it is also a autosomal disease, but with dominant autosomal disease, and it they are of 6 types. Okay, and most common type in India is type 3, Moti 3. Okay, and gene involved is HNF1 alpha, and chromosome which is involved is 12, and in this case we have defective secretion of insulin due to defective genes. Okay, and how it is known as maturity onset diabetes in young, because it remains asymptomatic till 25 years, then it starts to show its character after 25 years. And next we will see the treatment of this disease, that is treatment. First of all, we will start sulfonylureas which stimulate beta cells, beta cells which secretes insulin, means insulin production increase. Then we suggest him to diet control and do exercise, which increase GLUT4, means glucose channels which takes glucose inside the tissues present in the skeletal muscles, adipose tissue of the body, etc.